In the name of God, the Beneficent, the Merciful, and my case presentation is about hemorrhagic hepatitis. This is my channel information, Veterinary Pathology on YouTube. My name's Hossein Nourani. Liver from an 4 months old female lab was referred to our pathology department, Shahrikord University, and there was severe migratory tract on surface and cut section of the liver. This liver is fixed in formalin, so the intact portion of liver is pale. But there are numerous migratory tracts as black color on surface of the liver and in cut section. This structure is bile bladder, and there is bile imbibition as post-mortem change. When the histopathological slide of the case got ready, as you can observe in this photo, this part of liver is normal, is made of hepatocytes, but there is a migratory tract filled with red blood cells here, this part and this part, and two sections of the parasite larvae is seen here and here. This is higher magnification of the lesions. Again, you can observe the cuticula of the larvae and subcuticular cells, but this part is migratory tract filled with red blood cells, and this is a part of the larvae. This is higher magnification of the affected liver. You could observe hepatic cords is made of hepatocytes and sinusoid with red blood cells. This part is normal, but the right here, red blood hepatocytes, there is no hepatocyte, and migratory tract filled with red blood cells. And the last slide, you can observe cuticula of the larvae of the parasite, and subcuticular cells, red blood cells in migratory tract adjacent to the larvae, and severe infiltration of inflammatory cells. And thank you very much for your time.